The Eastern Cape is taking some drastic action, at least, and has taken drastic action over the past couple of days to deal with the rapid increase in COVID-19 infections. SANDF medics have been called in to help healthcare workers, and the Education Department has delayed sending additional children back to school. Dr. Thobile Mbhengashe is the Superintendent General for Health in that province. He joins us now. Dr. Thobile, good evening, and thank you so much for your time on the Pulse. I wonder how much of the situation that the Eastern Cape finds itself in now is due to the fact that some of the alarm bells that were being raised over the last couple of months don't seem to have been addressed with the level of urgency that the situation required.
Yeah, if you look at Western Cape, who is actually really much more in advance in terms of the epidemic, and their numbers have been very high. And I think Eastern Cape, because of proximities, will really follow a similar kind of a pattern. We're about a month behind Western Cape. But what's important is that the lockdown has given all of us an opportunity to build the healthcare services and respond. What we have done during the period, we built around 8,000 new beds, which we didn't have. We built about 300 ICU beds, which we didn't have. We've appointed over 7,000 new health workers into our system, and we're repurposing all our hospitals to actually able to manage COVID. So there has been opportunities to build resilience to respond to the COVID-19 surge.
When you look at the numbers in the Eastern Cape, and interesting that you compare it to the Western Cape, of course the population sizes are not the same, and also the level of economic activity that takes place in both those provinces are not the same. So there's some who are arguing that the Eastern Cape, those numbers relative to the economic activity to the population should be much lower than what they are right now.
Actually, if you really think about it, you know, the epidemic and really what is this epidemic is about, it's actually quite interesting because all South Africans are susceptible, and therefore the big drivers of the epidemic is really densities of the communities, high level of mobilities, crowding, poor socioeconomic, all those drives. Now, Western Cape, Eastern Cape, all other provinces are actually faced with the similar problems of the virus. So what is really important, what we're experiencing is that when you do the lockdown, you're creating an ability to build the services in order to respond. And the second part is that the next level of response is really a community-driven approach where each individual makes sure that they're keeping the social distance, they're wearing their mask, and they're washing their hands. I think there's no comparison about which province did better. It's because the whole drive of what's happening is really driven by the virus, and our response are really driven by the level of risk and other conditions that actually existed before. So we are actually slowly having each one of us a very unique problems how the COVID is actually getting to these communities. But why I use Western Cape is really to show that there is really no basis to think that some provinces that are less resourced are going to be are not actually responding. Even in a well-resourced, high-quality services like Western Cape will still have a huge element of the surge because of the nature of the epidemic.
It's interesting you're bringing up the role of wards, and it really comes down to the local councils and the municipalities and the work that they're going to be able to do in communities. Do you feel like you're going to be fighting a losing battle? Because in the OR Tambo district, they've shown us that they can't be trusted with this 4.8 million rand of a door-to-door campaign that effectively didn't happen, at least not in the way it was supposed to, and certainly not at the price tag that it came with.
I think that's very important for all of us to really realize that at the end, when you actually relax the restrictions of the lockdown, then you have to activate communities. What happened in OR Tambo is unrelated to the national or provincial strategy, which is linked to the local jobs. I think it has to be condemned if there's been any corruption, because what that does, it actually takes away the attention to the work that's been done. What's unique about OR Tambo, what's unique about Port Elizabeth, what's unique about East London, these are major transition areas with a huge migration. The virus, the way it works, once it gets into communities, the driver of the viruses are actually internal. They're no longer from outside. So what is important is that most of the work that we do is to make sure that we are really pushing and keeping the curve down, and we're putting the transmission to be lower, and we're making that the healthcare services are not overwhelmed. Where we are in healthcare services, we have about 900 people now who are actually in our hospitals. We have over 6,000 to 8,000 really preparatory work to admit patients. But what we're also learning is that there are new guidance that we know now that we can do. We can expand the critical care services because oxygen has been found to be critical. There's a dexamethasone, which is a drug that deals with the immune responses. So the information is changing, and I think we've learned from Western Cape. We're taking some of those lessons, and I think we're having help from national, including the military.
There seem to be questions about the credibility of the figures when it comes to those who have tested positive for COVID-19 coming out of the province. How are you aggregating the numbers when it comes to the private and the public sector?
This is actually very interesting and important because what has happened is that COVID was declared a notifiable disease. So I can tell you how many people tested in the public sector. I can tell you how many people tested in the private sector. All these numbers, every doctor who makes a diagnosis has to go through these national laboratories. So all our numbers are aggregated. What is important is that what we see is really a proportion of the numbers what exists in the community. The way we try and make sure that we know how the epidemic is happening is to push what is called the surveillance, making sure that you track and test and trace and isolate those that from the index cases. So the numbers are actually now, because of their numbers, are now slowly reflecting the true nature of how the epidemic is happening. And when they are mixed with the models refined, you get a good picture of exactly how the epidemic is working. My sense is that our numbers are credible, like all other provincial numbers, and if you look at from outside, the researchers, I think the country's numbers have been very consistently credible in the manner how they are done.
What role is the military going to be playing?
Yeah. This is actually very interesting because what we have from the military, they've sent us about 9 anesthetists. So we're going to be expanding the capacities to provide ventilation capacities because that's one of the things we think now is really a game changer, that we're putting oxygen reticulation of all the district hospital and beds. That means that we can expand our capacities to manage more moderate severe cases from the 300 on ICU to over 2,000. So the military anesthetists are going to help us with the reticulation, providing training to our teams, but we also have other teams in the system. We've got people who are also going to provide an ongoing support to other chronic conditions, medical conditions. We've got, urologists, we've got, dermatologists, and we've got a very good number of nurses. So the total 75 staff members that have been brought in are going to be a major boost. One of our challenges we have is that most of our staff has gone on leave. Some of them have got an infection, and so we need a replacement of staff. So this has come at a very great opportune time.
All right, let's leave it there for tonight. Dr. Thobile Mbhengashe, the Eastern Cape Superintendent General of Health.